Struggling with high blood pressure? Discover simple, natural methods to bring those numbers down and reclaim your health without relying solely on medication. From dietary tweaks to stress relief techniques, these practical tips can make a significant difference. Watch on to find out how you can take control of your blood pressure naturally. Welcome to Medical Minute, where we talk about health and I try to provide you an approach on how to lead a healthy lifestyle. If you are new to the channel, kindly consider liking and subscribing. So let's get on to it then. High blood pressure or hypertension is a common health issue that affects nearly half of American adults and approximately 1 billion people worldwide. Uncontrolled high blood pressure significantly increases the risk of heart disease and stroke, making it a critical condition to manage. While medication is a common treatment, there are numerous natural ways to help lower blood pressure. Here are 15 effective methods to manage your blood pressure naturally, along with additional insights and details to help you understand and implement these strategies. 1. Walk and exercise regularly. Exercise is one of the best things you can do to lower high blood pressure. Regular physical activity strengthens the heart, enabling it to pump blood more efficiently, reducing the pressure in the arteries. Research has shown that engaging in 150 minutes per week of moderate exercise, such as walking, or 75 minutes per week of vigorous exercise, such as running, can help lower blood pressure and improve heart health. Additional studies suggest that increasing exercise beyond these recommendations can further reduce blood pressure. Moreover, combining aerobic exercise with resistance training offers even greater benefits for blood pressure control. A study published in the American Journal of Hypertension found that a combination of aerobic exercise and resistance training was more effective at lowering blood pressure than aerobic exercise alone. This combination can be particularly beneficial for older adults who often face a decline in muscle mass and strength. Thus, reduce sodium intake. High salt intake is associated with elevated blood pressure and heart events such as stroke. Reducing sodium in your diet by avoiding processed foods and opting for fresh ingredients can help manage blood pressure. Although not everyone is equally sensitive to sodium, it's worth trying a low-sodium diet if you have high blood pressure. The American Heart Association recommends no more than 2,300 milligrams of sodium per day, with an ideal limit of 1,500 milligrams for most adults. A comprehensive review in the Journal of the American College of Cardiology emphasized that even modest reductions in sodium intake can lead to significant decreases in blood pressure, especially in people with hypertension. This underscores the importance of reading food labels and being mindful of hidden sodium in processed foods. 3. Cut alcohol consumption. Alcohol can increase blood pressure. While moderate alcohol consumption might have some heart benefits, excessive drinking raises blood pressure and the risk of other chronic health conditions. Limiting your intake to 1 drink per day for women and 2 for men is advisable. Reducing alcohol consumption not only lowers blood pressure, but also reduces the risk of other health issues, such as liver disease and certain types of cancer. Research published in The Lancet highlighted that there is no safe level of alcohol consumption for overall health, challenging the notion that moderate drinking is beneficial. The study found that any level of alcohol consumption is associated with an increased risk of various health problems, including hypertension. 4. Increase potassium intake. Potassium helps balance sodium levels in the body and eases pressure on blood vessels. Foods rich in potassium include leafy greens, tomatoes, bananas, hard avocados, dairy products, tuna, and salmon. Increasing potassium intake through a diet rich in fruits and vegetables can significantly lower blood pressure. The recommended daily intake of potassium for an adult is about 4,700 milligrams. A study in the British Medical Journal found that higher dietary potassium intake was associated with lower blood pressure in people with hypertension. Potassium supplementation was particularly effective in people with high sodium intake, highlighting the importance of balancing these minerals. Fish limit caffeine. Caffeine can cause a short-term spike in blood pressure. However, regular coffee or tea drinkers might have a lower risk of heart disease. If you suspect caffeine sensitivity, consider reducing your intake. It's essential to monitor how caffeine affects your blood pressure and adjust your consumption accordingly. A study published in the Journal of Hypertension indicated that while caffeine can cause short-term increases in blood pressure, long-term consumption does not necessarily lead to sustained hypertension. This suggests that individuals react differently to caffeine, and moderation is key. 6. Manage stress. Chronic stress can contribute to high blood pressure by keeping the body in a constant state of alert. Techniques such as listening to soothing music and reducing work-related stress can help manage stress levels and lower blood pressure. Incorporating relaxation techniques into your daily routine can have significant benefits for your cardiovascular health. A review in the Journal of the American Medical Association, JAMA, highlighted that stress management techniques such as mindfulness, meditation, and yoga can effectively reduce blood pressure. These practices help activate the parasympathetic nervous system, which promotes relaxation and lowers heart rate. 7. Eat dark chocolate or cocoa. Dark chocolate and cocoa powder contain flavonoids that help dilate blood vessels and lower blood pressure. Opt for non-alkalized cocoa powder for the most benefit without added sugars. Consuming dark chocolate in moderation can be part of a heart-healthy diet. A meta-analysis in the Journal of Nutrition found that flavonoid-rich dark chocolate and cocoa products were associated with reductions in blood pressure. The study suggested that these effects are due to the improvement in endothelial function and the increased production of nitric oxide, which helps relax blood vessels. 8. Lose weight. Losing weight, especially around the midsection, can significantly reduce high blood pressure. Combining weight loss with regular exercise amplifies this effect. Even a small amount of weight loss can have a positive impact on blood pressure levels. A study in the Journal of Hypertension reported that losing just 5% of body weight can lead to meaningful reductions in blood pressure. This effect is even more pronounced when weight loss is combined with a healthy diet and regular physical activity. 9. Quit smoking. Smoking temporarily raises blood pressure and damages blood vessels. Although research on smoking and sustained high blood pressure is mixed, quitting smoking reduces overall heart disease risk. The benefits of quitting smoking extend beyond blood pressure control to improving overall cardiovascular health. According to the American Heart Association, smoking cessation can lead to immediate health benefits, including improved blood pressure and circulation. Long-term, quitting smoking significantly reduces the risk of heart disease and stroke. 10. Cut added sugar and refined carbs. Sugar and refined carb intake is linked to high blood pressure. Reducing these can help manage blood pressure levels. Low-carb diets have shown promise in lowering both systolic and diastolic blood pressure. Focusing on whole grains, fruits, and vegetables can help maintain stable blood sugar levels and support heart health. A study in the Journal of the American College of Cardiology found that reducing the intake of added sugars and refined carbohydrates can lower blood pressure and improve metabolic health. The study emphasized the role of diet quality in managing hypertension. 11. Eat berries. Berries are rich in polyphenols, which are beneficial for heart health and can lower blood pressure. Including berries in your diet can improve cardiovascular risk factors. Berries, such as blueberries, strawberries, and raspberries, are not only delicious, but also packed with nutrients that support heart health. Research published in the American Journal of Clinical Nutrition showed that berry consumption is associated with improved blood pressure and vascular function. The study suggested that the antioxidants in berries help reduce inflammation and improve endothelial function. 12. Practice meditation or deep breathing. Meditation and deep breathing techniques activate the parasympathetic nervous system, helping to lower heart rate and blood pressure. These practices are effective for managing stress and hypertension. Incorporating mindfulness practices into your daily routine can promote relaxation and improve overall well being. A review in the Journal of Hypertension found that mindfulness meditation and deep breathing exercises significantly reduced blood pressure in people with hypertension. The study highlighted the importance of regular practice for achieving the best results. Trained, consume calcium-rich foods. A diet rich in calcium is associated with healthy blood pressure levels. Include calcium-rich foods like dairy products, leafy greens, beans, and tofu in your diet. Meeting your daily calcium needs can help support overall cardiovascular health. A study in the American Journal of Clinical Nutrition found that higher dietary calcium intake was linked to lower blood pressure. The study suggested that calcium helps regulate blood vessel function and supports healthy blood pressure levels. 14. Take natural supplements. Supplements like aged garlic extract, berberine, whey protein, fish oil, and hibiscus tea have shown potential in lowering blood pressure. Consult with a healthcare provider before starting any supplement regimen. Natural supplements can complement lifestyle changes and provide additional support for blood pressure management. A review in the Journal of Clinical Hypertension highlighted that aged garlic extract and fish oil supplements were particularly effective in lowering blood pressure. These supplements have been shown to improve endothelial duct function and reduce inflammation. 15. Increase magnesium intake. Magnesium helps blood vessels relax, which can lower blood pressure. Foods like vegetables, dairy products, legumes, chicken, beef, and whole grains are good sources of magnesium. Ensuring adequate magnesium intake through diet can support cardiovascular health. A meta-analysis in the Journal of Human Hypertension found that magnesium supplementation was associated with significant reductions in both systolic and diastolic blood pressure. The study suggested that magnesium's vasodilatory effects contribute to its blood pressure lowering properties. Conclusion. High blood pressure is a prevalent condition that poses serious health risks if left unmanaged. However, by incorporating these 15 natural methods into your lifestyle, you can effectively manage and reduce your blood pressure. These strategies not only lower blood pressure but also promote overall cardiovascular health and well-being. As we wind up, remember to take charge of your health by implementing these natural strategies to lower your blood pressure. Share your experiences and tips in the comments below. Don't forget to subscribe for more health tips and updates. Remember, small changes can make a big difference in managing blood pressure. What natural methods have you tried to manage your blood pressure? Share your stories in the comments. Remember to stay healthy.